How does the ACTH system work? Free cortisol secretes corticotrophin-releasing hormone. CRH then stimulates the anterior pituitary gland to release adrenocorticotropic hormone. ACTH then stimulates the adrenal cortex to release cortisol. Cortisol affects carbohydrate and fat metabolism. When cortisol levels are too high, the negative feedback system kicks in. The hypothalamus and pituitary glands are stimulated to stop releasing CRH and ACTH. Decreased ACTH. When the adrenal cortex has a hormone-secreting tumor, it causes increased production of cortisol. The pituitary gland then decreases production of ACTH, causing levels to become low as it is trying to decrease production of cortisol. This is called hypercortisolism or Cushing syndrome. Symptoms include hyperglycemia, poor wound healing, weight gain, bone weakening, depression, and a buffalo hump. This can also be caused by corticosteroid stress, alcoholism, and obesity. Increased ACTH. When the adrenal cortex has a disease that causes it to atrophy, ACTH levels are increased and cortisol levels are decreased. This is called hypocorticolism or Addison's disease. Symptoms include hypoglycemia, hypotension, dehydration, hyperpigmentation of skin, and electrolyte imbalances.
Click. Click. Do you suffer from depression?
Yeah.
Do you have what some may consider a muffin top?
Uh-huh.
Do you have a feeling of weak bones? Do you have an unexplained buffalo hump on your neck? You may have low ACTH. ACTH is a hormone that controls your cortisol levels. It's time to talk to your doctor. Yeah, okay.
Good morning. What brings you here?
Well, I've been feeling rather depressed lately.
Yeah. Are you covered?
Yeah, and I've noticed that I've kind of gained a pound or two.
Oh, I noticed. So, what is the symptoms?
Well, I've kind of got this thing.
Ah, buffalo hump. So, I think you have some problem with hormones. So, I'm writing some blood test work for you. So, then we will talk better. Okay.
A 25-year-old female visits her doctor complaining of depression, weight gain, and a large lump in her neck. Her doctor sends her for some blood tests. After blood is collected in an EDTA tube, it is placed directly in ice. From ice, it is immediately centrifuged. After centrifuging the sample, we will now take it to the analyzer and see how much ACTH is in there.
The analyzer uses a heterogeneous enzyme immunoassay that is separated with sulfonic acid reagent. An alkaline phosphatase label is added to compete with the patient's antigen. The solution is then washed, then measured by chemiluminescence. The amount of labeled antigen measured is inversely proportional to the amount of patient antigen present.
Beep boop, beep boop, beep boop, boop beep. Specimens for ACTH testing. ACTH levels are at their highest at about 8 a.m. and their lowest at 8 p.m. Samples must be taken at both times of the day in order to evaluate ACTH and cortisol levels properly. ACTH samples must be taken in a pre-chilled EDTA tube placed on ice and centrifuged immediately. Cortisol samples can be serum or heparin plasma. ACTH and cortisol are analyzed by enzyme immunoassay or fluorescence polarization immunoassay. 24-hour urine specimens can also be used for cortisol analysis.
it means that you have a hypercortisolism. So in this adrenal gland overfunction, and I'm prescribing some medicine for you, so it keeps your hormone level down. So this is the medicine for this problem, and I hope it will work. And $10.
The reference range for ACTH is up to 10 pmols per liter. The reference range for cortisol is 140 to 690 nanomoles per liter at 8 a.m. and 80 to 440 nanomoles per liter at 8 p.m. Our patient's ACTH results were low at both times, and the cortisol results were both high. It was found that she had hypercortisolism due to overfunctioning adrenal glands. She was placed on dexamethasone to decrease her cortisol levels. Current trends. There are numerous studies that are currently being run to test the effects of ACTH and cortisol levels. One type of study is aimed at the use of dexamethasone to decrease cortisol levels in order to decrease belly fat in obese patients. Another type of study is being done to test cortisol response by testing ACTH stimulation under physically or emotionally stressful conditions.